How do you capitalize on opportunities associated with diversity?
The kind of nonprofit that we are, because we're working with kids at risk, already you're dealing with a diverse kind of group. So it's not like we really have to ensure that, because we're open to any, race, culture, gender, anything. Any kid that comes in the door, we're open to serving. We're always out there looking for the best workers, because it's good to have people that from different backgrounds and different races and even different religions. We're a Methodist home for children, but we have people from different religions as well. For me, it's very intentional to make sure that I'm looking at all applicants fairly and equally.
Okay. What would you say is the most challenging part of being a nonprofit?
Funding. The money that we get from Medicaid or from counties to pay for the services that we give, that really goes to our families to provide the care. So it's not like we have the surplus of money to help our families. And so we work a lot with donations on trying to get things, because sometimes our kids come here with nothing. Like our kids may come with the clothes that they're wearing and have no other clothing or anything else. And DSS can just drop them off to us like that and say, you need to handle that. So for families, they do receive money for the payment for the kids, but it's, not a substantial amount to go buy a kid a whole wardrobe. So what we do is, we got to look in our own budget, but most of all, I try to look, into donations and try to get people to donate gift cards and clothing and stuff like that. And we wouldn't have that struggle if we were a public organization. Now, public, they also do struggle financially, but not as hard as the nonprofits do.
Could you say exactly how your organization directly impacts the community? What sort of changes do you see on an everyday basis?
So for the community, we are a resource to them. So, for example, we're right in Wake County, and Wake County Human Services, they're taking kids into custody pretty much, weekly. Kids that can't be with their families and their homes, and, whether it be neglect or abuse or abandonment. So we serve directly there, because we place those kids into our homes.
Like, how do people know about that organization? Do you have a newsletter or something that you send out?
Well, we have our website, and on our website gives all of our information about all of our different programs, and people are able to access that and see what we do. Our Spotlight magazine goes out quarterly, and the Spotlight goes out to anybody that is interested in our program. So whether they're a donor or not a donor, or they volunteered just once, you'll be on a list forever to get information about what we do and where our focus is and how our kids are making success.
How crucial volunteers and people getting involved are to your organization rather than just employees.
Yeah, we have a lot of volunteers from agencies like Progress Energy and big corporations to local people like yourselves and churches. Everything that we do, it takes more than just us.
Yeah.
Because there's, we're serving over 100 kids just in foster care, and then we also have our residential treatment programs and things like that. Yeah. So we're always looking for a hand. It helps out a lot, because being a nonprofit private organization, you don't get extra funding. You know what I mean? So you operate on your donations.
Yeah.
And so getting people invested in what we do and being a part of our mission, sometimes it makes people see, at first hand and say, well, I want to help these people. I'd like to donate. So it really helps our kids long-termly to have people that are a part of what we do every day.
After your child is adopted, how long do you keep contact with them, and in what way?
We're mandated to keep contact with them for a year. But like I was sharing with families at the adoption celebration, kids stay with us for a very long time. So, some of these kids grow up with us. And so it may be 10 years after the adoption, and we still have contact with them, because like I said, a lot of our workers, we've been here for a long time. I've been here for 7 years. I have workers that have been here, several workers that have been here for over 10 years. And so you can imagine, if you did an adoption with a kid whenever he was 5 and you're still here, we still have that contact. So we're mandated by the state to do a year, but we, our families they can contact us forever, whatever they need. So.
I guess I was going to ask where you guys get your cases from, or where you get the children from, I guess, in essence.
We get referrals from mental health, from local county DSSs, and we get referrals from Department of Juvenile Justice.
Where do you guys want to go in the future?
Well, for my program, the plan is to increase adoptions. So right now we do about 11 adoptions a year, and we'd like to be doing more of that. All of our adoptions are adoptions with kids that are in the system, so foster children, but we'd like to branch out into where we're doing private adoptions, where families are able, mothers are able to relinquish their rights, and then we can actually find a connection there. Right now, we're not in that field, and we'd like to get in that.
What is your favorite part of working here?
Helping kids and families. I've been working with kids and families, like I said, since I was 18. I was a freshman in college, and I always knew that I wanted to help kids. My favorite thing is working with kids, getting them to some success, and reuniting them with their families. So, seeing the little successes, like for, some of our kids, they really struggle with respecting authority figures. They were never taught certain things like how to accept feedback from adults or how to follow instructions because they've been bounced around their whole life. And to have a kid that actually you can see that change from one day they come in and they're fussing at you, cussing at you, throwing things at you, and then 6 months later they're actually asking you, Miss Erica, how are you doing today? Or, can I get you something to drink? Or, and they're really and they can show respect. So that's probably the biggest thing. And for our little ones, we have some kids that have been through some really horrible situations, and so to see them actually be somewhere safe and not be abused, and to know that we can find a family that will love them and care for them because their own family couldn't, that's very satisfying. So being, it's like twofold, working with kids, but then seeing the success stories like in adoptions or just in foster care.